Thank you so much for joining us today. My name is Corey Hesser. I'm one of the program developers with Kirkwood Corporate Training, and today marks the second webinar in our Mental Health Awareness webinar series. With us today, we have Emma Harding, who is presenting on mental health and access to care. Emma Harding is a licensed marriage and family therapist and current director of learning for the Meraki Institute at Tanager. Her background includes providing therapeutic services in schools, leading after school and summer programming for youth. Emma is passionate about spreading awareness and education regarding trauma-informed care and resiliency-based models. So with that, I will turn it over to you, Emma.
Thank you so much. I'm very excited to talk to you all today about mental health and access to care. Like she said, my name is Emma Harding. I am the Director of Learning for the Meraki Institute. I have been with Tanager / Meraki for almost 10 years now, and I've done lots of different trainings, services for youth in the area for the past 10 years. And so today what I'm going to talk about is that bridge and that building that bridge and that gap between mental health and access to care and why that's so important. And then at the end of the webinar, we'll talk a little bit about some local resources, how to engage some of those local resources, and then as well as more like international resources that you can utilize for yourself or for someone who may need it. Okay, so like I said today, we'll just really briefly touch on and identify influences on the brain and that play and have an effect on the brain. And really why I wanted to do this was so that we could really understand and get a good grasp of why it's important for to have access to mental health care and why it's important to have that healthy brain development and have access to making our brains more healthier. We'll talk a little bit about statistics and the link between healthcare access and mental health. And then, like I said, we'll just touch on like community-based and national resources. Some of them you may have heard of and have utilized yourself, and then maybe some are new. May is also Mental Health Month, and so I'll talk a little bit about what Tanager and Meraki have in terms of what's left for the month, including our summit that's coming up on May 30th. So we're going to move into brain development. And if you're not aware of brain development or haven't had too much education around it, it's fascinating. And some of the core statistics that are important to know and recognize about brain development are that our experiences actually shape our brain and they shape how we view the world around us, how we view relationships, how we view others' experiences and things like that. We also know what fires together wires together. And so what we mean by that is that experience wires something in our brain, right? So we're making these connections each time that we have an interaction with someone. Anytime we've had an experience with someone, there are connections and neurons are connecting in our brain. So what fires together wires together, and those are connected. Use it or lose it. So we really want to sort of, right? We want to really talk about like how we focus on our brain development, how we engage our brain. We do know that there's some research out there in terms of, and I'm sure there will be lots more as we continue on in terms of social media and technology and those kinds of things and what that's doing to our brain and how our systems are getting rewired from some of those experiences. And so we want to actively engage our brain to focus on healthy brain development. That goes from anywhere from, little ones to through adulthood. Sometimes if you think of, if you're just kind of mindlessly scrolling, what's that doing to our brain? Versus if we go outside and we take a walk around the block, or how we're engaging our brain in different ways, and how going for a walk is probably more healthy and enhancing of our brain development than choosing to scroll on TikTok or Instagram for that 20 minutes. We also talk about neuroplasticity, and that is just saying that the brain is very malleable. And so the younger we are, the younger we are in age, the more plasticity our brain has. And so really that means that we can kind of come back from things, right? Like our brain has this ability to develop and grow and change. Sometimes, um, if someone has like a traumatic brain injury or maybe they have a stroke or something like that, the younger they are, the more chance that they have in terms of being able to regain some of that brain functioning back because of the neuroplasticity in regards to that brain. And so the way we engage our brain and the way we kind of recharge all play a factor in that very important piece of brain development. Other things that we want to be mindful of when we think of the brain and we think of mental health is that there are multiple factors that can influence healthy mental, emotional, behavioral, and social development. And so you'll see here, those are listed. And so that can go from anything from your trauma, toxic stress. And so what we mean by toxic stress is kind of like a repeated stress over and over. Let's say that you are working with a youth who has chronic homelessness. That's a lot of toxic stress that's involved in that environment that would play an effect on healthy mental emotional development. We know there's economic factors, systems, generational patterns. So that could be through your family, that could be through lots of different avenues. It doesn't have to be just your family, but if you think of these kind of like systems perspectives, that plays a factor into it. We know that culture can have an effect on your social, emotional, and development and the environment that you live in. And so that can be from like on a micro to a macro level, right? So that could be the environment that you are truly living in, to Cedar Rapids, to the state of Iowa, to living in the United States, and that kind of thing. So there's lots of different systems perspectives to take into consideration. And all of these factors really do influence your brain development and your mental health and your ability to cope in situations and to be able to be mindful of those emotional, behavior, and social development pieces. Okay, the last thing I want to talk about with the brain is our emotions in the brain. And so when we think about the brain itself, I like to think of it as we have three parts to the brain. If you're ever looking for a good resource in terms of maybe like youth development and the brain, The Whole Brain Child is actually a wonderful book that explains the development of the brain from kind of that developmental toddler to youth perspective in a really great way. And so some of this is taken from Dr. Dan Siegel and The Whole Brain Child. And so what he tells us is that there are three main parts to that brain. And I'll talk about them from like the top down, or the top down perspective. And so we want to start at the bottom here. And that was what we call kind of like our reptilian brain. It's really the reptilian brain is responsible for your survival, your reproduction, those kinds of things. That is truly what saves us. It's something that is just innate in you. And so that's like that primitive part of the brain. Then the next level up would be your limbic system. And that is where you're housed, like your emotions, your empathy, kind of like those parental emotions, those kinds of things. And so in that limbic system, where we might find ourselves getting a little more emotional and we're able to reach into those emotions a little bit. Or if we don't have access to that, right, then we're shutting that off. Then the very top part of your brain, so ideally all three of these are working together, but that top part of the brain is really where we have like that critical thinking and that logic comes into play. And so when we are in distress, when we are we have something maybe that's causing us to have some anxiety or depression, there are the parts of our brain that will shut off first are the top parts. And so if I am put in a situation where I am feeling highly stressed out and I'm starting to become dysregulated, I will actually start to lose. The first thing I will lose access to is my neocortex, so that very top part of the brain. The next thing I will lose access to is the limbic system. And then I might live in that reptilian part of the brain if I am completely dysregulated. And so when we're working with youth, or even for ourselves, if we're feeling dysregulated and we're like, man, I just cannot get myself to problem solve, that's because we're losing access to that part of the brain. How we gain back access is to know what works for us or the youth that we're working with. So whether that's engaging in some mindfulness, whether that's if we're way down in that reptilian part of the brain, when we think about our needs being met, a lot of times it's sleep, it's water, it's food, right? It's those survival things. And if we start to maybe, let's say I get some water in me and I'm cooled down, I go outside, it's a beautiful day today, and I'm not as hot and sweaty, then I start to gain access to my limbic system, which then allows me to think about my emotions, maybe have some empathy for the situation that I'm in, which then allows me to open up into my neocortex where I can do some problem solving and some thinking. But if I'm not able to get myself regulated, then I can stay in that downstairs part. So that's just important to remember when we're thinking of either if we're working with youth or for ourselves. If we're kind of in these states, we really truly do lose access to those top layers first. And we've got to make sure that we are connecting with that bottom layer and meeting its need before we can go to that next top layer. Okay, so we talked a little bit, right, about just the importance of understanding brain and brain development and how that plays an effect on mental health. And so now I'm going to you'll see that there's some statistics here on your screen. And these were pulled from the 2022 State of Mental Health in America. And you can go online and they actually have a very detailed report and a very detailed, lots of statistics, but I thought these were some good ones to pull out for what we're talking about today. And they really survey across the United States access to care, and they survey access to care through like medical care, through mental health care, and then they also look at it over time. Iowa was kind of in the middle for some of these statistics, but we can go over a few of them. So nearly 50 million or almost 20% of American adults experienced a mental illness in 2019 per this report. They do survey both adults and youth. And so 15% of youth that they surveyed experienced a major depressive episode within that past year. I thought this one was very interesting. So about 25% of adults with a mental illness report an unmet need for treatment. And this number has not declined since 2011. So that's a very, very long time for that number to rise or for that number to remain the same level in terms of, it makes you wonder about access to care and kind of where we are with that in terms of mental health and mental illness. And so that's an important statistic. So if you're finding these statistics interesting, you can go ahead and Google that report. Like I said, there's lots and lots of different information in there that's really says a lot about kind of where we are in terms of the United States and access to care. This is just a quote from the World Health Organization director. And really, just to sum it up, he just talks about that everyone's life touches someone with a mental health condition. And so when we think of good mental health, it translates to good physical health. And this new report that the WHO put out, there are major links between mental health and public health and human rights and socioeconomic development. that we really need to think about transforming mental health policies and practice so that we can really start to deliver mental health and access to care in a way that is going to be a better investment for humans overall. And so, you know, when the next few slides we'll talk about is truly your access to care. Here are the different ways. And so when we think about all of these statistics, we know that currently there are lots of people that are struggling. We also know that the healthcare system in general is going through staff shortages, budget cuts, all of those things. And so the more that we can advocate, the more that we can reach out to our policymakers and be really mindful of those things, especially within our state, or how we can help control some of those pieces or advocate for some of those pieces is really crucial because just what we learned about brain development and the statistics that are showing nationwide, we're going to have to do some work in terms of advocacy to make sure that people are really understanding how important mental health care access is. And if we see an increase in mental health care access and the ability for it to be accessible to everyone, then we will see our healthcare statistics, physical health will be on the rise, and emotional health, all of those kinds of things. And so we'll get into this latter part of just talking about some resources. And so obviously I am with Tanager in Meraki. And so I wanted to highlight some of the services that we currently have within our organization, and then I'll go into some more local resources or where you can find them if you're unsure. And so part of it is just what we know research has told us is like that reach out, that first initial reach out can be part of the hardest thing for some people. Maybe it's that the access to information isn't there. Maybe it's that I am so scared and I don't want to be that person that reaches out, or I don't know how. And so here's some information for you. And there's numbers and there's email. And so hopefully a different variety of ways for someone to reach out that they feel comfortable with in order to get themselves access to care. So you'll see that Tanager has a number of services. We have our outpatient services, which provide your outpatient therapy, your psychiatric, your psychological. We do see adults, and I think sometimes people don't know that, but we will see an adult if their child is somehow connected to Tanager in some way, shape, or form. But we also see young adults too. So, and those young adults do not have to be connected to a child. So anywhere from like, I would say 3 to about 20, 25, 24, like through college. And then after that, if that adult is connected somehow to a child of Tanager, then we will see them for services. So we have therapy, psychiatric, psychological, so testing, medication, outpatient therapy. We also have school-based services. They're on their website. We do list what districts we serve and what schools that we're in. We're in 12 districts and 60 some schools, so I'm not going to name all those for you today. But if you want more information, you can email schoolbasedsoup@tanagerplace.org. We also have our community-based services, and so that is BHIS. And so that is your behavioral health intervention, and they do a lot of skill building. And so what I like to say is for therapy, we're getting to the roots, and BHIS is kind of the limbs of the tree, and they're going to those skill building pieces, and they're really working on those pieces that are vital in terms of a child functioning in the school system, a child functioning at home, those kinds of things. We also have PIH and Expressive Arts, and a brand new program that we're going to be bringing into Tanager is called MST. And so there's probably going to be some more information coming out about that, but we're excited for MST. If you're interested in any of those services, here's a number to call. We also have our residential. So we have a PMIC and an ICFID facility. And those are inpatient, where the children are living with us on campus. And then we also we have kind of a soft opening of our Crisis Stabilization House. It's about that's a brand new program that is brought to Tanager within probably the past, I think, 2 weeks we've been up and running. So there's more information on the website about that. But that's very short-term care for kids who don't meet the need for hospitalization, but maybe need some respite for a few days in order to get themselves back into a more stabilized, regulated state. And then you also have our Meraki Institute of Learning, which is where I'm kind of bringing with you today. And that really is for professionals and families. So if you would go on our website, and at the end I'll have a QR code that you can scan if you're interested in more information. But we host trainings, we host webinars, we have resources. We have May Mental Health Month, and at the end of the month, we're hosting a summit, and that is going to be a half-day free opportunity for really anyone that is interested. We have a speaker coming in, and then we'll also have a panel really talking about resiliency in youth and that mental health care. And so that is a half-day event that we would love to see you at if you're wanting some more information about that. We have that all on our website. We also have some virtual and in-person parent support groups right now. So if that's something that is of interest to you or you know someone, hop on our website and you can sign up for those. Okay, a few other things that I just wanted to make sure were listed in terms of local resources is that Linn County does have a mental health access center for crisis support. Foundation 2 Mobile Crisis is also a support that can be accessed. If you're ever like, I need more information, I need numbers, and I'm not really sure where to go, you can call 211. And that is just free comprehensive information and then referral systems to Health and Human Services. And then also on Linn County's website, they have a comprehensive list of like counseling resources under their mental health resources like tab that you can go and access. And it's a PDF that has a lot of different nonprofits in the area, private practices, those kinds of things in terms of mental health support. So that's also a great resource for you. These are also, lastly here, just some national, there is a Your Life Iowa, which is a 24/7 crisis support in Iowa. There's the numbers to call or text. And then the rest of them, I believe, are national based. So you have your National Suicide Prevention Lifeline. And so that's just 988. And that was, I think, introduced maybe like 5 or so years ago, maybe longer, and in support of mental health. And it used to be a very long number that you had to memorize, but now it's just 988. You can also, if you don't feel comfortable calling, there's a crisis text line that you can have access to. For LGBTQ plus population, maybe you feel more comfortable going with an organization that has the knowledge and support. The Trevor Project is a great resource for you or for someone. And then also the Veteran Crisis Line is listed on there. The other thing that I wanted to add is just that if you're ever like, man, I don't know where to start for therapy, I'm not really sure how to find like if someone's a good fit for me or I want to know more about them, there's a website called Psychology Today, and that is a really great way just to look up like mental health care providers, and you can do some research regarding providers prior to reaching out to them. And it's really kind of just like a bio and a highlight of providers. And you can list, it's a national website, so you can really look wherever and see what their interests are, what their specialties are, what insurance they take, if they do take insurance, that kind of thing. But that's a great way to just kind of do some research and some looking for yourself to feel comfortable prior to reaching out. Okay, so I have given you the list of resources. We've talked a little bit about brain development, and I am going to open up if anyone has any questions or would like further information. I'm happy to open up the chat here, or if you have a question, you could raise your hand and could call on you. So I'll give people a minute here if they have anything. Feel free to put it in the chat. Okay. Well, if no one has anything, I just want to say thank you so much for your time today. Like I said, if you go ahead, there's that QR code at the bottom. My information's at the bottom. If you have any questions that maybe you didn't feel comfortable asking in the chat or would like to kind of go offline, please feel free to email me directly. I'm happy to have conversation with you. And I really hope to see you, some of you, at the summit at the end of the month. That would be fantastic. And thank you so much to Kirkwood for this great opportunity.
Absolutely. Thank you so much, Emma. We're very appreciative of you and your time that you took today. As Emma just mentioned, just a reminder about the 3rd Annual Mental Health Summit on the 23rd. And we would love for you to come be part of this event that is being put on by the Health Occupations team. So thank you for joining us today. Everybody have a great weekend.